Hello and welcome to North Country Matters. My name is Donna Seymour. I am a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. My guest today is Dr. Julie Sorensen. She's the director of the New York Center for the Agricultural Medicine and Health Center of the Occupational Health Clinical Network here in New York State, which is a long string of names, but it's also known as NYCAP short in short speak. So the work of the center focuses on our agricultural community. Julie, welcome to North Country Matters. Your colleague, Jeanette Zockler from the Syracuse Clinic, has been a guest on the show several times. So let's dive right in and start by asking you to describe how your center fits into both the OHCC network and the national efforts to improve the health and safety on the farm.
Okay, so thank you so much for inviting me to be here with you today. And I'm very happy to talk about the work at NYCAMH and the work of the NEC. We're a bit unusual in that we receive funding through the Occupational Health Clinic Network to provide occupational health services and resources to the farm community within New York. But we also receive funding from the Centers for Disease Control to conduct research and develop programs throughout the Northeast, so from Maine all the way to West Virginia. We are a little unusual as there are several occupational health clinic networks in the state, but those clinics focus on a specific region, but are open to all workers, whereas NYCAMH serves the entire state, but focuses on one specific industry, and that's agriculture. And the reason for that is agriculture has been widely recognized as potentially dangerous industry, and farmers have typically been featured in the injury statistics as having some of the highest rates of injury and fatality.
Yeah, I know. I was reading some of the background material, and the Northeast Center also works a lot with the logging community and the fishing industry as well. So those three occupations certainly share a lot in terms of occupational hazards, don't they?
They do. They share a lot. I mean, they're highly physical occupations. There's a lot of exposure to the weather and the elements, and they're typically using heavy machinery, which is dangerous by design. Well, it's not designed to be dangerous, but certainly it's designed to dice and chop and crush or pull in heavy loads, and it's just it's equipment where people can become entangled or injured fairly easily. I think those industries are also very similar in respect to the folks who work within them can be isolated for long periods of time. They're largely the people working in the industries are the business owners, so there's a lot of pressure to make ends meet financially. They're subject to all of the trials and tribulations that come with having your product affected by global trade wars and pricing. And so I think that introduces additional stressors.
Yes, it certainly does. And as far as farming goes here in New York State, it is big business. In 2017, New York State farms produced 5.7 billion, that's with a B, dollars in gross income. And when you add in the agricultural support businesses and the processing businesses, it rapidly grows to 44.8 billion in 2014. New York ranks third in the nation for milk sales, second for the production of apples and maple syrup, and third for both wine and grape production. Certainly here in St. Lawrence County, milk and the dairy industry is a big part of our agricultural production. There are more than 3,300 farms across New York State, and they employ more than 55,000 workers, including a lot of migrants and temporary help. Farming can be a dangerous occupation, as you mentioned. The dairy industry has more worker injuries and deaths than any other type of farming. You manage the Farmers Occupation Health Clinic as part of the OHCC network. What are the kinds of worker injuries that you see at the clinic, Julie?
Well, so that's an interesting question. I think as you mentioned, we have a farmers occupational health clinic. We tend to see more occupational disease in those clinics because injuries are often kind of fall under the classification of emergent care. So people are typically seen in emergency rooms, but we will follow up with folks who have experienced a traumatic injury. We have a social worker here who can provide case management, counseling assistance, assistance with insurance, disability, return to work. So they have worked with VESID to provide assistive technology to farms or farmers who've been injured and want to continue to work. But to answer your question more specifically, the types of injuries that we typically see on farms are machinery entanglement injuries or livestock handling injuries. Could be, I think we tend to see things like occupational health exposures that relate to respiratory issues or repetitive strain injuries, musculoskeletal disorders, arthritis. I mean, thinking about respiratory issues, farmer's lung was one of the primary focuses of research when we first established NYCAMH, and that comes from exposure to organic dusts, but there's also exposures to chemicals or gases that in high concentrations can be detrimental to human beings.
So as you point out, there is a difference between occupational disease and occupational injury. And so, and you've talked a little bit about some of the occupational hazards that farmers and farm workers can be exposed to. Are there other things that you're looking at specifically and doing some work with at the clinic?
Well, so we, I have to say, we see a wide variety of health issues in the clinic, but as well as treating people who are sick, we spend a lot of time thinking about prevention. So some of the things that we're working on, we've just hired somebody who is looking specifically at tick-borne disease and prevention of tick-borne diseases, because it is such an issue when people go, I mean, the process or the tests for diagnosing are somewhat complex and not always accurate. And if they go undetected, it can be, they can have extreme health effects, especially for an individual who's very physically active. So secondary or tertiary Lyme disease can be incapacitating. So it's just very problematic for farms. So we're experimenting with different options for reducing tick populations. So we've just applied for funding to look at that. But we also provide things like farm worker fit testing clinics. So we will come to the farm, or we have county level or county specific fit testing clinics where people can come, and we will get them fit tested to make sure that they have respiratory protection that works for them. We train them on how to use it, how to put it on, how to take it off, when to replace it. So we try to focus. We do a lot of things just really focused on prevention. The other thing I would like to mention is, we had talked a little bit about traumatic injury and preventing traumatic injury. One of the most frequent causes of death on farms is tractor overturns. And it's one of those things where it's kind of frustrating from a public health perspective, because we have a solution, right? You can put a roll bar on a tractor. Roll bars are, fairly widely available, and yet people continue to die. And so that's why about, over 10 years now, we started the New York State ROPS rebate program. And that program helps farmers identify roll bars that will fit on the model tractor they have. And we provide a cost share for doing that. And so a farmer's out-of-pocket cost will never be more than $500 to install something that could save their lives, their workers' lives, their families' lives. So we have programs like that. And then we a few years ago, we started a program called the John May Farm Safety Fund program. And that program also provides cost sharing for safety improvements on the farm. And actually, it's just interesting because a lot of the projects have focused on implementing or installing livestock handling equipment. And because that is such a source of injury, it's so nice to see farmers taking advantage of that cost sharing opportunity to reduce their exposure to something that often leads to, debilitating injuries.
I know from friends in the local area who are farmers, many of them have, for example, tractors that are quite old. They may have
Right.
been tractors that their fathers or their grandfathers had. They're still used on the farm in specific instances. So going ahead and retrofitting that stuff gets to be very expensive. So it's nice to see programs like this that are available because the equipment still works. It's just not something that you throw away given the costs of modern farm equipment. It's so prohibitive.
Well, and those older tractors, you know how to fix that, right? So no farmer wants to get rid of that. We actually tried a tractor trade-in program and it was not popular at all. Nobody wanted to do it because they said, I know how to fix this tractor. I like this tractor. So I think the solution was let's just, really invest our time and effort into helping farmers put roll bars on their tractors. And the thing is, it's not only cost sharing, but we have a national coalition, and that includes representation from the tractor manufacturing groups. And so given this coalition and our ongoing work with them, we can provide engineering and technical feedback to the farmers because sometimes it might be hard to find the right roll bar for your tractor, but given these connections that we have with a coalition, we can provide a lot of logistical support. And I think that reduces the hassle factor for farmers as well as the cost. And I think that just makes it a, absolute win when it comes to a prevention program.
I'm curious because your clinic is one clinic serving the entire state. What are the logistics of going to farms from your location? Because this is a big state and much of it is very rural. So there's a lot of time consuming just getting to where people are who need the services and the help.
I know. Well, yeah, we spend a lot of time on the road. I think the joke here is we should be paid by the mile versus the hour because we have people. It's interesting, even in the office today, I think we have half our staff out in the community providing some kind of training service. And so it can take more time to do that, but I think the reality is that farmers, they're even busier, and trying to ask them to leave the farm to take advantage of services is just too challenging. I do think though we've had to alter our approach at times to meet increased demand. So for example, the respiratory fit testing clinics have been, there's been a high demand for those. And so what we did was we worked with cooperative extensions to find a central location within the county. And then we just asked farms to come there so that we could process more people versus taking that time to drive from farm to farm. So we've had to make accommodations at times, but we have such a dedicated group of individuals serving the farm community. Many of them have grown up on farms or have worked with farms their entire lives. And so there's a real passion for the work that we do and the people that we serve. And so, they put in long days, but they believe in the mission.
Well, and when you've got community partners like Cooperative Extension, which is all over the place, it makes it easy to find, as you say, a central location so that you
Right.
can serve more people with less drive time for your folks. So many of New York's farms rely on seasonal or migrant workers to provide the hands-on services during the season. And many of these workers are no longer native English speakers, so providing them with health and safety training must take some additional burdens. What resources do you bring to help this population get the training they need and the safety information that they need in order to do their work?
Well, so we have several staff members who speak fluent Spanish. So often the trainings that we provide are in Spanish. We have materials that we've created that are focused on the most frequent hazards that you would see on farms, with suggestions and information for Spanish-speaking workers on how to identify and how to address them. We actually, Anna Meyerhoff, who is our safety, one of our bilingual safety specialists here, just won an award for her work on, the work that she's done at providing safety training to Spanish-speaking workers, and she has partnered with an illustrator, Salvador Sens, who also won an award for work that they collaborated on together in the development of materials that are kind of more focused on pictures versus a lot of narrative, so that they're just easier to read and understand. And the narrative that is there is in Spanish. So really, we've just tried to develop resources, posters, pamphlets, handouts, and actual in-person training that's in Spanish.
So you meet people where they are and try to fill those needs, and not be rigid in how you approach these kinds of issues, because you can't be, can you?
No, we try to be very flexible.
So I have to ask, because we've all been living with it for more than 2 years now, how has COVID impacted farm workers and farm worker safety?
Well, that's a great question. I think that we did a survey in the midst of COVID with the farm worker community. We didn't get the response rates that we wanted, but that's understandable. People were working very long hours and kind of dealing with their own personal COVID challenges. But what we did see is that by and large, it seemed that workers were getting information about how to protect themselves. We're getting access to hand sanitizer and face coverings. I think the challenge was, one of the bigger challenges was transport. So getting to work, getting back and forth to work. If you're ride sharing, how do you protect yourself from COVID when you're sharing in a car with other people for extended period of time? And then just another thing that was mentioned that was a bit of a concern when we looked at the numbers. Quite a high percentage were worried about financial issues related to the pandemic, access to healthcare, and we found that telemedicine was an appealing option for workers if it was available. And then I think the last thing was very high rates of stress, mental health issues, and even violence amongst people kind of within a family unit, talking about abusive behavior. So so I think the takeaway there was people were farm workers are essential workers. They had to continue to work, but they had the same stressors that everybody else had in society, with thinking about exposure, how to get treated, where to go for care, where to get a vaccine, all those things.
Right. So as you just mentioned, much of New York State is rural in nature, which means healthcare can be difficult to access and find, especially for low-income workers and migrant workers. What are some of the challenges that you face in helping to ensure that agricultural workers in New York State are getting the care they need?
I wish I could be original here, but the biggest challenge is funding. I think the funding that the Occupational Health Clinic Network has received has been flat over the past decade. And I think even in the past year, inflation has considerably increased. So, we have, it's just harder to do, to meet the mission with fewer dollars. And I think, sometimes staffing is a concern. I think all businesses are facing that, having sufficient staff to address all of the needs and cover all the activities that are required on an ongoing basis. So hopefully that's something that we can address in the years ahead. But we have great partnerships and we have great support from the agricultural community and from the health community as well. And so we hope that those challenges can be addressed in the coming years.
So you've mentioned a little bit about some of the prevention services that you offer and the programming that you developed. Can you talk a little bit more about how farms can actually access these materials for their employees? It's not always a case of having you come to the farm, is it? There's some other ways that you can help.
Yes. So I think the easiest way to find out what resources farms could take advantage of is to visit our website. And that's www.nycamh.org. And so the website has a list of our programs. It has downloadable resources. It also has a list of our fit testing clinics, where and when they're happening. And it has a toll-free number. So if farmers need something, I would encourage them to check out the website. If you don't see what you need there on the website, just give us a call. Chances are we have something that can assist or be helpful, and we can just kind of talk through what people need and connect them to resources, materials. We do a lot of technical assistance over the phone, so we have industrial hygienists. You can answer questions about what kind of personal protective equipment do I need if I'm using this chemical. We can answer that question. We also have a personal protective equipment program where we can send respirators or equipment to the farm. And sometimes what we do is we coordinate with our trainers who might be going out that way. And so we can save shipping costs by just having one of our trainers drop it off at the farm. So anyway, I would just encourage people to visit the website. There's lots of information there. If you don't see what you need there, just give us a call.
Okay, and I also noticed that you have some videos, some safety videos in your library that people can access right there as well, which is everybody loves to YouTube the answer to a question these days. So that's great that those kinds of resources are also available. So I've been thinking a lot about food lately because of high prices, and we know about the transportation glitches in terms of getting stuff moved around the country. So really and truly, people thinking about local food and accessing their food locally, there's safety issues there, and there's also cost issues there. So what you folks are doing to help the farmers is really helping all of us, isn't it?
It is. I think I'd just like to give a shout out to the farming community. I think that there's a lot that they had to endure during the pandemic, being essential workers. And they just did it. They were remarkably resilient and flexible, and in a job that was already kind of, already had involved long hours and a lot of a lot of stress. It just introduced a whole new level of stress and workload, and they navigated it in the way they always do, which is just put your head down and get it done. And so I just would love to give a shout out and thank you to them.
I think one of the things we've learned in the last 2 years is what essential means when we talk about workers, because there are folks who can't do it from home, who can't telecommute. They have to show up in person and do their work. And those folks really, that's who we all depend on, and we need to recognize that and reward them appropriately for that. So Julie, as we wrap up today, any final thoughts you'd like to leave with our audience about the work you do and how the center can help to make farming safer for all of the employees?
Yeah. So yeah, I think I guess my takeaway message would be, if you're a farmer and you're struggling, you don't have to do it alone. I think if you can reach out, chances are we have a service or a program that can help you in some way. If we don't have the solution, we can connect you to partners who do. And I know that farmers are used to just figuring it out themselves, but it doesn't, you don't always have to do it the hard way. And there are resources out there that can be helpful, and I just urge you to take advantage of them if you can.
Well, thank you, Julie, for coming in today by the miracle of Zoom, which has been another unexpected benefit of COVID. There have been lots of unexpected not benefits, but this is certainly enhanced our ability to communicate and to share information, and so that's a good thing. The work you do at the center is absolutely critical work that needs to be done in New York State, and we certainly appreciate how you go about doing that and how much good it really does, because it's the sort of thing that unless you're directly involved in an industry, you might not think about the mechanics of how to do it. So you guys have done that thinking, and you are able to share that information. And for folks who have been exposed to occupational disease, there's help out there for them, isn't there?
There is. We're here. Call us.
I will be sure to put the phone number and and your website and other information in the show notes as we finalize this video for production. So thanks again for coming in. I really appreciate it. It's been a pleasure to talk to you and to learn more about what the center does. So these conversations are a production of North Country Matters, which is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. As we like to say, until next time, remember, our North Country matters.